Welcome to Grand Rounds at the UCSF Osher Center for Integrative Health. My name is Shelley Adler, and I'm delighted to be serving as the director of the Osher Center. And today it is my great pleasure to introduce Dr. Sean Cotton. Dr. Cotton is the director of the Osher Center for Integrative Health at the University of Cincinnati. Yes, our sibling institution in the Osher Collaborative. She's chair of the Turner Farm Foundation and vice chair of the Academic Consortium of Integrative Medicine and Health, which is our field's international professional organization with over 75 now. How many? Yeah, and Dr. Cotton will be serving as chair of the consortium next. As a clinical psychologist and a professor in the departments of family and community medicine and pediatrics, Dr. Cotton leads a research lab with ongoing clinical studies, research focusing on mindfulness, mind-body interventions, non-pharmacological approaches to coping with chronic illness, and practice-based integrative health. Dr. Cotton's work in mind-body medicine, mindfulness, nutrition literacy, group medical visits are truly well known throughout the field as innovative and impactful. She earned her PhD from the California School of Professional Psychology and completed her clinical fellowship at Cincinnati Children's Hospital Medical Center. So a moment of housekeeping. After Dr. Cotton's presentation, we'll have about 15 minutes or so for discussion. So please submit your questions to me by way of the chat feature anytime throughout the presentation, and you'll also be able to pose directions in person, as it were, to Dr. Cotton after the discussion. Lastly, I want to thank our Grand Rounds Planning Committee, Dr. Selena Chan, Anand Dhruva, and Patty Moran, as well as Jen Shea, Yvette Coulter, and Julia Burns. So please join me now in welcoming my fabulous colleague and wonderful friend, Dr. Cotton.
Thank you so much, Dr. Adler. Good morning, everyone. I hope people are safe and dry. I also echo my thank you to the Planning Committee, and particular to Jen and Yvette for all of the hard work that goes on to make these things happen. I am going to start a share screen and see if this works. Can we see the screen here, Dr. Adler?
We can. We are in your presenter mode, though, so there we go.
Great.
Now we're set.
Great. Well, again, delighted to see everyone online. I'm a very interactive presenter, so it's tough sometimes when I can't have people raise their hands or see them, but I appreciate that some of you are doing your yoga stretches or drinking coffee with your videos off. I don't see a chat, so what I'm going to ask a question maybe once or twice and just invite Dr. Adler, who I think can see the chat, to answer back out loud so we can all kind of see. So I just want to start by just asking, how many people on the call do you have a mindfulness practice? If so, what is it? Maybe just one or two words. If you don't have one, what might be a question that you're thinking about this morning? Just so we can see if we can address some of those. So go ahead and chat that in if you're able, and we'll give it just a moment. Do you have a mindfulness practice? And if so, what is it? And if not, what might you be interested in learning today?
I'll read you just a few here. Daily meditation and breath work. Folks keep typing them in. Twice daily meditation practice, sky yoga. Someone does daily Vipassana based, but it goes in waves. I think we can all relate to that. Yep. A breath work, daily meditation.
Wonderful. Anyone not have a practice and willing to say, I don't have one, but I'm curious, or maybe this really is a group that sounds like a lot of people have a practice already. It's great.
Here's someone who doesn't have one, but is curious.
Very brave, whoever that is. Very brave you are.
A public disclosure.
Fantastic. Wonderful. Well, welcome. Again, I hope there's something here that's useful. Please feel free as I go to put a question into the chat, and Dr. Adler, please feel free to interrupt me. I can always send slides, and I much prefer to talk as we go.
Great, thanks.
So we will see now if I can advance. Here we go. So to be a bit formal for a moment, as it is Grand Rounds, our goal is to understand a bit about the drivers of burnout and the impact of chronic stress on well-being, to describe the science behind and then some of the evidence for the use of mindfulness and mind body techniques for well-being. And then, as always, to experientially practice some things together. I hope to have some fun and be able to engage a little bit together. So we all know the problem, but I'll put something up that people may not know, which is that the World Health Organization actually dubbed stress the health epidemic of the 21st century several years ago. This was before our COVID pandemic. But the impact from obviously from a life perspective is real and people know, but from a cost standpoint, stress costs businesses up to $300 billion a year. Back when this study was done, and it has stayed the same, about 50% of people feel that stress negatively impacts their work productivity, never mind their personal situation. And then the volume was turned up in the world in the last several years. COVID-19, the amount of financial issues, isolation, real suffering for many, many people, issues of a war going on currently, and particularly the issues around racial injustice that have really just, it's as if the volume on what was already a stressed global, perspective, but in America has really just been turned up. And so I don't say this lightly when we say that stress is a real problem that we all know about. And so I invite you to look at these words and see if anybody ever feels like any of these. Frenzy, distracted, swamped. Anybody feel like all of these, like all of the time? And I don't know if you can see the thing on the right. It says, "What the hell is that?" And the little person says, "Well, that's just my mind." So in the middle of trying to work, raise families, be happy, be good stewards in the world, our minds are always on the go because this is sort of how we're built, and there's a lot going on. Even on this call today, I will invite you to. It's really easy to get online, to do your emails, to check your texts, to be doing stuff. I invite you an opportunity during this hour together to actually try and single task if you can. Even if you tune me out for a little bit and you just single task on your text and you come back, but use even this time together as an opportunity to see if we can unclutter and just focus on one thing. And then we move into healthcare, and this is a bit of an old, white older man perspective of physician, but you look at the guy on the left who's the doc, and it says, "What seems to be the problem, Mrs. Johnson?" And she says, "I feel the way you look." So we take stress in general, and we bring it into kind of the healthcare setting. And issues of physician burnout and healthcare provider burnout as well are real. Many of you know Tate Shanafelt, and 1 in 2 physicians, still the data is fairly strong. And we all know it's not just physicians, it's our frontline staff, it's our MAs, it's our patient services reps, it's our nursing staff, that the healthcare industry as a whole is squeezed. It's financially squeezed, and the pressures are very, very intense. And so people will say to me, "Sean, can you really measure burnout?" And I say, well, yeah, this is what we do in academic medicine and research. We find ways to measure stuff, right? So many of you have heard of the Maslow burnout inventory. This is Christina Maslow, was a research psychologist who put that out, and is probably the most often used burnout measure in studies that you look at. And the way she describes it is that burnout is a response to chronic stress that wear on you over time. It's not the acute stress, but it's so big that you sometimes don't even know that it's there because it's constant. And so it just builds and builds and builds. And there are 3 sort of sub areas that when she identifies and when we look at burnout, we're thinking about. So I invite you again this morning to think about your own personal well-being and also that of your colleagues. And so one of the areas of burnout is emotional exhaustion, which is you get to the end of your week, your month, maybe it's your day, and there's nothing left in the tank, so to speak. You're kind of running on fumes. Depersonalization is the second area that they measure, and that is sort of, the ability or the problem of really depersonalizing students and patients. They become sort of more numbers rather than really keeping the humanity part. And then a low sense of personal accomplishment also defines burnout. And again, I would bet that most people on this call, I certainly saw our colleague, Dr. Rick Hecht, on the call, but many, many people have CVs that for most people, they think, "Oh my gosh, look at that 100-page CV." But people that really struggle with burnout say to themselves, am I really doing anything? Like, am I really making a difference in the world? And again, these are serious consequences to burnout. This is a great paper by Shanafelt, noseworthy, from the Mayo Clinic. If you look at the right side of the consequences of burnout, professionally, we know when people rate higher rates of burnout, they do have increased rates of medical errors. decreased patient satisfaction, decreased professional effort. And we know it costs health systems at least $1 million, probably more, at least when a physician turns over and other faculty members. And then you look at the personal side of the consequences of burnout, broken relationships, really significant alcohol and substance use, depression. We do lose about 400 physicians to suicide a year. We unfortunately lost one of our OSHA affiliated faculty a month ago to suicide. So these are real issues when it comes to burnout and stress. The drivers of burnout are across these multiple factors. The drivers are at the individual level, they're at the work unit level, organization, and the national. And because the drivers are at these levels, the interventions have to be at these levels as well, right? And if people haven't seen this paper, the 9 organizational strategies to promoting well-being and reducing burnout, it's a fantastic paper. And what they did was they interviewed hundreds and hundreds of people, and they found that these were the primary drivers. So again, think about either your own well-being or your team this morning. And what they found was the workload. You know, I always joke like I have a to-do list that's never to done. I think many of us feel like that. It's just, you're never done, right? It's just, when can you actually stop for the evening? How much control and flexibility do you have over your schedule or not? Our clinicians have less flexibility sometimes than others of us. How work-life integration, we don't really call it balance anymore because there's no real balance, right? How well can you integrate your work and your life? How much social support do you feel or not feel at work? Again, primary driver of burnout. How much do your organizational values line up with your personal values? Obviously, if they're more in alignment, there's less burnout. But if they're really misaligned, how efficient or inefficient are your teams, maybe your electronic health records? And at the end of the day, meaning and work in the middle here. Meaning and work is at the end of the day, one of the most important elements when it comes to thinking about burnout. And so what they said in this paper was, if these factors here are less optimal, if they're not in alignment, you get more burnout. But however, on the flip side, if you can optimize these things, both for your own team, for yourselves, if we can optimize flexibility, social support, we can get more engaged teams that are less burned out. Many of you, again, still I'm making the case here, but many of you know about Don Berwick's triple aim, where, early 2000s, he said, he and his team, in order to really optimize the healthcare system, we have to focus on patient experience, population health, and reduce costs simultaneously. But the paper that got less attention was that in 2014, where Bodenheimer and colleagues came in and basically addressed provider satisfaction, i.e. burnout and well-being, and said, really, in order to really get a well-functioning healthcare team, we have to absolutely pay attention to the team itself. And we have to include that just as much as some of these other elements. So again, as we look at building resilience, reducing stress, the role of potentially mind-body, I'm going to be focusing this morning on individual strategies. That's what I do. It's what I know. It's where I spend some of my time. But it's in no way to downplay the real critical importance of what are you doing in your work unit? What are we doing at the organizational level? And then what are we doing at the national policy level? All of these things have to be functioning together, but we'll just be focusing a little bit more on individual today. This is one of my favorite models. If people haven't looked at this, the Stanford Professional Fulfillment Model of Well-Being. What I like about it is on the left side of the slide, they start by saying the premise is that promoting professional fulfillment and mitigating burnout requires organization-wide change. So that the role that UCSF or that you see in Cincinnati or wherever we are, the role that our organizations put on creating cultures of wellness, the role that the OSHA team or other teams that you work on, the role of the efficiency of practice cannot be underestimated. These are really critical. These interface with personal resilience, that these are all, but they work together, but that the role of the organization is very, very important. So again, we're going to focus a bit more on personal resilience today. And I'm a psychologist by training, and I think we throw out this term resilience a lot. So I want to spend just a minute talking about what is resilience, again, as we think about the promotion of well-being. And so the term that I certainly was trained on, that many of you have probably heard, the American Psychological Association, this is how they define resilience. It's probably the most often used definition: the process of adapting well in the face of adversity, trauma, tragedy, threats. This is my new favorite definition, though. And some of you may have seen this by Epstein and Krasner. They define resilience as the ability of an individual to respond to stress in a healthy, adaptive way, such that personal goals are achieved at minimal psychological and physical cost. And then my favorite part, resilient individuals not only bounce back, but they also grow stronger in the process. And the reason we have a picture of a tree here is for those of you that know anything about tree, and certainly the trees in your area have gone through this a lot, is that there's a process by which when trees actually have lots of wind pushing them over, they actually grow stronger afterwards. Their root systems become stronger and they actually embed more. And so it's an incredible natural phenomenon that I think they're describing well here when it comes to the ability of people to face incredible adversities and somehow actually come back on the other side stronger. And then this is a beautiful book written by Stephen Southwick. For people that are interested, he wrote a book called The Science, of Resilience. And he studied thousands of people that had had trauma, multiple kinds of trauma. And at the end of the day, wrote this book with kind of 10 elements of how to become resilient. But his bottom line point was anyone can learn. Obviously, people have certain things that set them up more or less for success to be able to be resilient, but that these are teachable tools, things that we can learn. I'm going to take a pause. I don't actually have a place for a real question yet, but if there are any questions or comments so far before I delve into this.
Coincidentally, one just came in, which is how do you define grit and what is its relationship to resilience?
Oh my goodness. Great question. And I'll be the first to say, I actually don't know a lot of things. I know a lot of people that know a lot of things. I don't have a great answer for that. And I don't know who asked it, but whoever did, does anyone on the call, if my colleague Meredith McGraw is on, she would know the definition to grit and have an answer. Does anyone on the call have a better answer than I don't know, which is actually my honest answer this morning? It's a wonderful comment.
Dr. Becker, if you want to join and
please unmute.
Elaborate on your question, do, but I don't know if you're able to get to audio.
Oh, there he is. Dr.
Hi
Becker.
there.
Hi.
Good morning.
Good morning.
This has been an ongoing question of mine for quite a while, and I don't have an answer either. This is why I was asking. So I would love to get thoughts from anybody who spends more time on this question.
And Dave, will you give us just a background sentence for folks who are curious as to why you're even asking the question, and then we'll crowdsource it and we'll see what we can come up with later.
I imagine the interest is coming along the same lines as many people on the call. So I'm a pediatrician and I'm a psychotherapist, and I work with kids and young adults and others with chronic pain and other complex medical issues. I've been teaching mind-body strategies for 20 years, including mindfulness as well as clinical hypnosis, biofeedback, and others. And the notion of grit is one that comes down culturally that to me is often associated with a kind of approach or mindset that isn't always healthy. But I also wonder about how it relates to hormetic stresses and a quality of meeting stresses that actually contributes to resilience in the long run.
Thank you.
Yeah, I wish I had a better, and again, I agree with maybe afterwards we can, I'm happy to ask my colleague Meredith McGraw, who would have a really thoughtful answer to this. I appreciate the work you do, Dr. Becker, and I think whatever role that we're in, it's a great, just in general, thinking about not great, but how do people respond to threats? How do people respond to stresses? How do you do it? I don't know if the grit term, I hate the like pull up your bootstraps. Is that the right term to use? And I don't know if that has some of that, which is for lots of reasons, that's not always possible for people, right? But I do think given your area of interest, that book, that Stephen Southwick book might be one that would be an interesting read. And we will try and come back with a better answer to your grit question. Thank you for raising it. So again, I'm going to focus on some good things soon, but I'm just going to remind ourselves of the stress response. And there's a lot of people on this call that could describe the actual physiologic process much better than I can. But I will just say to us this morning, think about the physiologic stress response that happens, right? When you're crossing whatever road or something happens, and we all know what happens, right? And if we were in a room, I'd have you yell out, my heart's racing, my hands are sweating, whatever, sweating or heart racing. But what happens physiologically is really important to think about when it comes to then how do we engage mind-body strategies to help. Our brain perceives a threat no matter what the threat is, financial, emotional, physical. If it's perceived as a threat, this cascade hits, right? And it's an immediate cascade. And it's an incredible one. Again, if we were together, I would say to you, is this good or bad? And eventually we would get to the answer of, well, it depends, right? It does depend. But fight or flight has gotten us out of the way and continues to get us out of the way of a lot of really bad situations. And so why is it on my slide this morning? And why is it a problem? And I can't see anybody but Dr. Adler, but I kind of am waiting to see her hand. How many of us deal with one stress at a time? Think carefully before you raise your hand. See, she raised the hand. One stress, right? And herein lies the problem. Oh, there's Dr. Kavita Mishra. Good morning, Dr. Mishra. Maybe she only deals with one stress at a time. And you can give this talk. If we have teenagers, which I have 3, if you have one of these, which is a phone, we're dealing with it all the time. It's coming at us all the time. And so what we're not here to talk about is why the stress response is bad, because it's great. But let's think about the impact of chronic stress on our brains. Again, we do this day 2 for our medical students. Stress is not inherently bad, but what we know is that high levels of cortisol all day long, this is bad for our brains. We get things like atrophy in our hippocampus, shrinking of the area that's responsible for what? Short-term memory. You can't find your glasses, your phone, atrophy of your prefrontal cortex. You can't make decisions well. So there are all of these actual structural changes that I think sometimes people think, oh, I can manage it. Let me just grit. Let me just get through it. Our brain is not designed for this. It's not designed, because the amazing thing about fight or flight, it's designed to shut off when the threat goes away. But therein lies the problem, is that oftentimes for many of our patients, our students, our community members, ourselves, we're running on high all the time. You don't sleep well, you're yelling at your partner or your kids or people in your life. So it's the impact of chronic stress we're thinking about. Now, here's my favorite slide, and I know I have several of my consortium colleagues online. This is courtesy of our great colleague, Dr. Haramati. This took a medical student a week to build, so make sure you watch this one. If you're on your emails, this is the one to watch. So importance of returning to baseline is how we like to think about the importance of the role of mind, body, and mindfulness techniques. So stress hormone on your left. So I'm going to pick on Dr. Adler because she's the only one I can see. So she comes to Cincinnati, and I asked her to come up. I'm on the 4th floor of the medical sciences building, and I asked, she wants to take the stairs. She's pretty fit. And so, okay, her kind of, her heart rate goes up, her stress hormone's up by the time she gets to the 4th floor. But by the time she walks down the hall, her heart rate has kind of returned to normal. She has returned to baseline. Next time I say to her, Dr. Adler, why don't you carry 30-pound weights with you this time while you come up the 4 stairs of, 4 flights of stairs? Well, she gets to the top of the stairs, but you can see a moderate loss of resiliency. She doesn't quite bump back. Her cortisol level doesn't quite settle down. And then I say, hey, why don't you do it this time? You didn't sleep for the last 2 nights. One of your kids isn't well. I know she just went through COVID. And you can see, and this could be by 9:02 in the morning. Think about your own team and your own life. And you just haven't settled down yet because somebody calls, something happened, you get an email, you're upset about something. And again, what we've just done is talk about the impact of chronic stress on your brain. So this isn't great for anybody, whether it be your patients, your students, yourself. So again, it took a medical student a whole week. This is to build this. So watch this. This is what we're going for, right? How do we return to baseline? Hashtag RTB is what one of my community colleagues calls it. How do we return to baseline, both personally and for anyone in our life? And how do we do this throughout our day, right? As opposed to just in the morning with a morning meditation, how do we do this at noon? Where is your baseline at 4 p.m.? How about 7:30 p.m., right? And so the question is, what can help you? What helps you personally? What helps people that you love? I did do a talk like this once to a wonderful group of women CEOs in Cincinnati. They were anybody in the C-suite, CFO, CEO, COO, and it was during a happy hour. And one of them yelled, marijuana. And I know this is a grand rounds, but I would just say, like, whatever returns you to baseline, it's going to be different. Maybe it's calling, maybe it's going for a walk, maybe it's a bath, maybe it's playing with our children. I see a beautiful child on the call this morning, which is delightful. And so what helps us return to baseline? Oh no, I really was very happy to see her, by the way. So everything we do at the Osher Center, much like your Osher Center, is to help work towards transforming a system of primarily disease and sick care to well care. And we all know the bases of health and wellness, which is what we eat and choose to put in our bodies, how we move, how we manage our stress, how we connect with the world around us, whether that be interpersonally, in nature, spirituality. These are all based, this is all science-based, and these are the foundations of wellness. So again, today we're focusing on building resilience through kind of stress reduction techniques, but not to underplay the importance of the many, many marathons that Dr. Hecht has run, or food and all of the other important things that contribute to our wellness. So I don't need to tell this team about the concept of mind-body medicine. The only thing I will say to this team is this is not new. You know, when integrative medicine brings mind-body forward and food is medicine, these are thousands of years old concepts. It's just that we're bringing them into the healthcare system. And again, the data is so robust. As a psychologist by training, there's decades and decades of research as it relates to the engagement of the relaxation response, the use of self-awareness. So these are not new, and this team of all knows this. But these are some of the techniques, again, that many of you utilize or that you utilize with your patients, Dr. Becker, things like meditation and imagery, biofeedback. If you're not familiar with autogenic training, it's used a lot in Europe, a lot with kind of gut and somatic disorders. It's kind of a self-hypnosis where you say to yourself repeatedly, you know, my arms are heavy and warm. I am at peace. My arms are heavy and warm. It's a really wonderful practice that I think is used a little bit more still in Europe than here. Breath techniques, movement, yoga, tai chi, and then certainly things like journaling. But sometimes we don't think about journaling as a mind-body technique, but certainly the role of Pennebaker's work as it relates to kind of getting out traumatic or important events and putting them down on paper. Again, not new for this team. Again, the data is strong. We'll move into some practice and do some things ourselves soon, but the data is very strong. Lazar's group, Hulza's work, many have been doing the data that shows that things like, 8 weeks of mindfulness-based stress reduction, this is not a 5-minute app on your United flight when you pull up Calm, but really 8 weeks of consistent practice. As we know, most of the data has been done on these, 8-week programs are associated with real changes in the brain, increased gray matter density in your hippocampus for learning, for memory, areas that are important for self-awareness, introspection. So the data around the why, I think, has gotten a lot stronger, certainly in the last 20, even 25 years. Now, translating that into the how and helping people adopt them is part of the art of what we do in healthcare. The other data point I'll put up here is some of you in the call may not be as familiar with telomeres, but some of you probably are. These telomeres, they're the little caps kind of on the end of your chromosomes. So think about your shoelace or the shoelace of one of your kids, and those little tiny caplets at the end of the shoelace. They're like the little plastic piece that keeps the shoelace in place. That's kind of what the telomere is. And as you age, that little plastic piece, just like on your shoes, kind of starts to go away and it frays at the end. And actually, as you age, your telomeres get shorter, natural process of aging. What some people may not realize is that adopting things like yoga and mindfulness lifestyle approaches actually can cause reversal of these markers of aging, namely things like oxidative stress, telomerase activity, and that things like mindfulness meditation actually have been shown to increase your telomere length. So when you see some of those studies that say, oh, meditation, on Good Morning America, oh, meditation can increase your lifespan, that's where some of this data is coming from. But I think it's real data to think about how do these things work, right? How might adopting these practices actually provide us more time with our families and our loved ones and those of our people we work with. So I know I'm saying what is mindfulness to a group, and pretty much everyone on the call would give me the definition. And if we were in person, I would say, hey, someone give me your best definition. But I'm going to give you 2 more that I love, even more than Jon Kabat-Zinn's definition. So I will provide it on here just for those people less familiar. Jon Kabat-Zinn, he was in Massachusetts doing this incredible work in the basement of the hospital. Patients with chronic pain were sent to him and they were getting better. And he was starting to do what was called mindfulness-based stress reduction, right? We now have 40 years of wonderful data on it. And he talks about it in pretty simple terms, but there's a lot packed in. It's an awareness. It's nothing fancy. It's just an awareness that arises through paying attention in a very particular way, i.e. non-judgmentally, on purpose in the present. So not in the past, not in the future, to really what's unfolding moment to moment. And so even think for a minute now, since I've started talking some 25 minutes ago, you've probably checked your email, maybe your phone, maybe you're working out, you're doing something else. That's a natural thing. Maybe you're thinking, when's she going to be done? I have a lot to do. Or it's natural for us to come and go in and out. But what we know about mindfulness is when we're actually in the present, I'm going to show you some of the benefits, we can attend better. We can be more effective. We can be more productive, oftentimes happier. There are so many incredible benefits. And so the 2 definitions that I like even better than Jon's definition that I want to share this morning are, let me see if intention, can you guys see the bottom of my screen there? Intention, attention, and attitude. So mindfulness is setting the intention with your child this evening or with your loved one to pay attention to really what they're saying, like as opposed to processing your list, with an attitude, a non-judgmental attitude. And just bringing those three things in, that is mindfulness. And then here's my second favorite. Meriden directs our workplace mindfulness. She goes, Sean, it's really just the opposite of automatic pilot. Like, how often are you like in a meeting and you'll sit and go, I have no idea what that person just said, right? Because your brain is somewhere else. You're processing something out. You got something that's really, really important. It's taking ourselves out of automatic pilot, and it's noticing like, wow, my body really doesn't feel great right now. Let me stand up and do a shoulder roll, a neck roll, so I don't have a headache at 6 o'clock at night. But it's really coming out of automatic pilot and really coming into intention. What's happening right now in my body, in my mind, in my heart, with my emotions. So I hope those two definitions, again, intention, attention, attitude, and the opposite of automatic pilot, might be able to give you some language when you're talking to people. I have found it very, very useful. And so why mindfulness and why now? Well, I hope I've maybe convinced you a little bit, maybe not yet, that mindfulness is one mind body technique that we know can downregulate our nervous system. We know it can return us to baseline and quite literally change the parts of our brain associated with stress. And again, I just think the science is incredible. Many of you know the concept of neuroplasticity, that we really have a lifelong capacity to create new connections in our brain. How? By eating right, by moving, by doing things like stress reduction. I mean, it's not, again, rocket science, but really taking these concepts and helping people understand that we have more impact over kind of our health outcomes than sometimes we like to remember. And again, I won't bore too much, but just to show you a little bit of some of the neuroplasticity and the data, what we know is that, again, and most of this has been done on these 8-week MBSR programs, that the part of the brain associated with higher order brain functions like awareness, concentration, and decision making, your prefrontal cortex, becomes thicker after regular practice. Your amygdala, your fight or flight kind of emotion center, we know it shrinks after kind of 8 weeks, consistent. Again, this is not just an app. This is 8 weeks of practice. And we also know that the connection, the functional connectivity between these areas and the rest of the brain changes. So the areas between the amygdala and the rest of the brain get weaker, and the connections between the prefrontal cortex and these areas get stronger. And what does this mean, Sean? This means mindfulness allows us to be responsive and not reactive. So rather than reacting from kind of the amygdala fight or flight, something happens and you snap in a meeting, or you, again, I have 3 teenagers at home, and this is a practice. It's a practice for a reason, because I'm out to dinner 2 nights ago with 2 of my boys. And every time I say something to Jonah, my 16-year-old, he goes, "Shut up, Sean." And he can only say it so many times, at which point I say, "Jonah, we're going to have to rein this in." But, you know, myself at times will snap and I will yell, and then I will feel really, really bad. And so I hope I'm not the only one on the call. But there are times in meetings, in family conversations, where we just want to react. What mindfulness will allow us to do is pause, because we're actually training ourselves to pause and then choose how to respond rather than just react. And I've seen this, and again, I've seen this not only in myself, but in others. And the more we practice this, it's practice for a reason. The more we practice, and who doesn't want to be able to be more responsive in their life and less reactive and be able to have more choice? So we are going to practice here soon. These are the benefits. They're extraordinary. And I'll put these up and say, who doesn't want this? Better immune functioning, better working memory. I'm 51. Things are starting to shift here. Focus and productivity, increased emotional control, relationship satisfaction, leadership abilities. I mean, the data is very strong. I don't have all the references up here. I apologize, but I'm happy to send them. And then decreases. So people that have a regular mindfulness practice, decrease rumination, symptoms of anxiety, depression, stress, and burnout, reactivity. And rumination, I will just say for a minute, it's as if, you know, you ever get stuck with a thought and you just can't get out of it, and you're just sort of stuck with it. And think about thoughts in your brain, kind of like a river, almost like a river. And the more the water runs through it, the more it just continues to embed and get stronger and stronger. Mindfulness practice will allow you to notice that you're stuck in that negative thought, that water just continues to run. You can learn to notice and then shift course. Oh, here I am. I'm having that thought once again. let me actually try something different. So it's incredible. The other, I don't have a slide on this, I'm sorry, but one of our colleagues who talks about how mindfulness might work, this is one of my favorite examples. I don't know if Dr. Hecht uses this, but I would be curious. And what Richard Sears will say is, Sean, it's like exposure therapy. Think about classic exposure therapy as a behavioral scientist. Imagine jumping in a pool. If you jump in a pool, what happens immediately? You're frozen. No matter what happens, you're freezing, right? And you're freezing. What happens is you stay in that pool. You stay in the pool and oh my gosh, all of a sudden within like a minute or two, it's no longer freezing, right? It's kind of like class or exposure therapy. And so Richard Sears will say mindfulness is the same way. You might immediately pay attention to the pain in your shoulders or your back, or maybe you're going to pay attention to your anxiety. But if you stick with it and you stay with it non-judgmentally, it softens. All of a sudden, the pool water is not as cold as it was. I hope that makes a little sense. We're going to do a practice here. I'm just looking at my time. Organizationally, there's a reason why Google onboards every employee with 8 weeks of mindfulness training. There's a reason why Aetna has a chief mindfulness officer, because we know that organizations and teams like the Osher team and others that pay attention to these things, they work better. They're more compassionate, they're more responsive, and all of these things. I want to get to a practice. So I'm going to go really quickly through the three. I have to circle back a little bit to the physician burnout case. We've looked a lot at these studies. This is a meta-analysis of 15 trials, looking again at burnout in physicians. And many of these studies have looked at things like mindfulness, stress management. I think probably one of the key pieces of these studies are the small group discussions. They're done in really supportive group settings. This was another study of 70 primary care physicians from Rochester who rated high in burnout. They went through basically a classic John Kabat-Zinn 8-week program, and surprisingly, not surprisingly, they did well. I think the most surprising thing of this is that it was published in JAMA, which is really great to kind of get the word out widely. And then the last one I'll show you here is just an abbreviated study, because again, many of our studies are on the 8-week programs, but what if we only have 4 weeks? What if we only have an hour, right? And so this was again a 4-week modified program that again showed reduced burnout scores. So I hope I've made the case a little bit that it's not a magic bullet, but that we do have fairly good data to suggest that if we practice mindfulness, we can in fact reduce burnout, increase empathy. So I'd encourage people to just think about that in their own days. We're going to practice. Dr. Adler, I'm looking at my time. I think we have time for practice, right? Let's practice. So again, I invite everyone to please, for just a few moments, if you're able to turn off your screens and your phones and just give yourself a few minutes to see what this is like for you. You might be a very experienced mindfulness practitioner. You might never have done it, but just take a few moments, settle into whatever space you are in. If you are sitting and you can uncross your legs, put your feet flat on the floor, put your arms and legs in a place that feel good for you. And if you're able and comfortable to close your eyes, if not just a soft gaze downward. And I'll just invite you to practice dropping in early in the morning to a few moments of self-care where there's nothing to do, nowhere to go. Start by bringing attention to the top of your head. Notice the weight of your head drops into your shoulders, shoulders into hips, hips into knees, into the floor, the earth below. And we'll just start by noticing what is here for us this morning. Notice how your physical body feels. Notice thoughts that you're having. Notice your emotions, what's rolling around. Again, in a mindfulness practice, we're not changing, we're just noticing with awareness. So you might just kind of do a check-in. It's almost like an inventory. How am I feeling and doing right now? And you might say to yourself, whatever I'm feeling, it's already here. Let me just experience it for a moment. And when your mind wanders, which it will because you're human, gently come back and ask yourself the question, how am I doing right now? And now gathering up all of your awareness and attention and seeing if you can gently put all of your awareness on your breath. If for some reason your breath is uncomfortable this morning, feel free to choose a sound, just something that's constant or something to look at. But if you're choosing your breath, just noticing your breath, what are the qualities of the inhales and the exhales? Are they deep? Are they shallow? Again, not changing or altering your breath in any way, just noticing. Again, an invitation. The breath is just one option. Feel free to choose something else to just focus solely on for the next 30 seconds or so. I promise that's all. And when the mind wanders, practice bringing it back again and again and again. And now in this final moment together, see if you can gather up all of your awareness and sense your full being in this moment. Really seeing if you can sense your entire being. Maybe using the breath as a guide, starting down at your toes, watching the breath as it moves up your legs, into your hips, your torso, your chest, neck, and out the top of your head. Really just sensing your full being. And then we will end this brief practice today by just thinking about one thing you're grateful for this morning. Maybe just saying, I am grateful for. If you have any trouble coming up with one, you might just say, my breath this morning. And then slowly and gently, there's no rush at all. Starting to slowly guide your awareness back into whatever space you are in. Maybe wiggling fingers, toes, a neck or a shoulder roll, a stretch. If you've noticed anything's tight, and then coming back onto the call with your colleagues this morning. And I invite you to type into the chat just one word about how you're feeling right now. Good, bad, otherwise, and then Dr. Adler can let us know. One word, how are you feeling?
Light, refreshed, happy, calm, sense of peace. Thank you. Calm, relaxed, better, content, ready.
Beautiful. What about the bad ones? Anyone feel anxious, annoyed, tired? It's okay. They're all welcome here.
Aware of pain in my back.
A pain in my back. Yep. That might mean you need to stretch, move around. People often say to me, students will say, Dr. Conant, what happens if I fall asleep during meditation? I say, well, what do you think you need more than a meditation then? Go to sleep. So it's not always positive, right? Well, thank you. I know I'm running up on time here, so I'm going to try and cruise through. It can be difficult. The reason I put this picture up here is just to say, and we'll talk for a few minutes about the how, and then we'll open it up for questions. But, you know, nobody has time to go for 45 minutes or 10 days off to sit and meditate. I mean, some people do, but I'm not retired yet. But, you know, we're trying to do this in the middle of our days. And so how do we really take 60 seconds before we go into the next patient's room, before we walk into home? How do we actually weave this into our lives? This is our wonderful Dr. Mira Murthy, who's one of our psychologists who does MBSR with us, and she's just a delight. And so, you know, cultivating mindfulness, again, many of you have practices. You can do a formal practice, but a lot of time patients, especially in students, this is what they're afraid we're going to tell them to do. Oh, you have to go and sit and meditate for 45 minutes. No, you don't actually have to. We all know that we can weave these into our lives informally with activities of daily living. And if we can do both, better for it. But you can take a mindful walk, you can teeth brushing or showering. Next time you're brushing your teeth or in the shower, are you actually paying attention to the smell of the soap, to the feeling of the water? See if you can really just attend for 60 seconds to actually just your teeth brushing as opposed to processing your day. That's practicing mindfulness when you're coming into present moment awareness. And so just a couple ideas. Again, many of you have practices, but you can do this anywhere. You can do this at a stoplight when you're really upset, you're late about something. You can just check in with yourself. No one will know that you're doing it. You can block in mindfulness breaks. We try, I'm certainly many of you do this, to not run our meetings right up until the hour. See if you can build in even 1 minute to breathe, or see if you can build 1 minute or 5 minutes in between your Zoom calls that tend to run over into, forever. We start our department meeting with a mindful minute now. I think what's interesting is doing this outside of our OSHA meetings. See if you can do it in your department meetings. See if you can do it in other meetings where people don't really know what you're doing. I'll never forget one of our former deans that I did it in a room of like 45 people, and I opened up my eyes and he was looking around like so surprised that people actually did this. But it really does help change culture, and it doesn't have to be swanky. It's like, let's just set our intention. Let's take a few breaths like Jen encouraged me to before we started, and let's just set our intention to be together. You don't have to fully eat mindfully, but try picking up your coffee, your tea, whatever you start in the morning, and maybe just the first sip instead of just guzzling it down. See if the first sip you can really enjoy the smell, the feeling, the taste. That's considered practicing mindfulness. If we had more time together, we would do a mindful listening practice. I tell you this, if you haven't done this with a loved one or someone you trust at least, spend 2 minutes and sit across from someone that you care about and say, for 2 minutes, I'm just going to listen to you fully, and try and really just listen. Don't cut off, don't judge, don't give advice. We do it all the time. I do it all the time. This is hard. And then you switch and you have the other person just talk. It's an incredible practice. And when you think about building these into your teams and why that teams might do better when they are encouraged to do mindful listening. Notice your transitions in between work and home, in between meeting to meeting. We come with a lot of baggage, and then we go into the next meeting or the next patient care or the next experience with our family. Notice that and develop a practice to kind of let go of some things as you can. Go for a walk. I know I'm over my time. I'm going to cruise through this. I promise, Dr. Adler. I tell you, for me, my shoulder. So I am a chronic pain, neck arthritis person, and my personal practice has helped me notice how much I was really literally holding for like 10 years. So even something small where you put a reminder on your phone, are you clenching your jaw? Are your shoulders tight? Doing mundane tasks with awareness. I know that we're taught to multitask. Our brains actually don't work well multitasking. We are much more efficient when we single task. And habit chunk. People will say, how do I start this if I don't know how? Or if someone asks you, put it next to something you do. So I'll say to someone, you brush your teeth every day, hopefully, put a 60-second practice right at the end of your teeth brushing. Habit chunk it. Put it next to something that you already do in order to develop a new practice. There's my little guy. Well, that's Noah, my oldest. Pretending like he's meditating. Anyway, for those of you who want to start, pick a time when you won't be interrupted. Be consistent. It's like exercise. This is not like you can meditate once, then 8 weeks later, try it again. It's like working out. You kind of have to figure out something to do every day, even for 60 seconds. That's better than nothing. Consistency is much, much better, and you will see benefit from it. Try something else. If you hate sitting like Noah like this, don't sit. So walk and do something. Invite yourself to be gentle. Try something else. Now I really know that I'm over time. We have a mind body course here. You have other things here. I hate when people do this in talks. We do a faculty training in mind body medicine. I'm sure you all have similar programs. Dr. Hermati and I run this here in Ohio. We've trained about 100 faculty. It's really fabulous. A really accessible. I know you have so many resources. This is one that's coming up. It's a 5-week, like really practical how-to. It's $125. It's $99 for Osher Center people that we love, and we can always work on sliding scales. But again, I know you guys have so many resources at your disposal. These are just some of my favorite websites and apps. I meditate to angel love every morning. I really do love John Kabat-Zinn's Wherever You Go, There You Are. The How to Train a Wild Elephant, our colleague Vic Serpina taught me about. They're like little simple tools. I do this with my class. There are lots of other things, but I'll stop because I know I'm over time. Grateful to be here with you all. I will stop sharing and open it up to Dr. Adler.
Thank you so much, Sean. Absolutely fantastic. I want to give folks an opportunity to ask some questions. I'll ask the first question that was sent in the chat and then invite people to go on video if they would like to ask a question directly. There was actually a little bit of a cluster of questions acknowledging that your presentation is focused primarily on individual strategies, but do you have workplace institutional strategies that you've seen that are meaningfully supportive of healthcare workers' well-being? So ways that institution can support what you've shown us.
So my guess is the people that asked me that have a lot better responses. So I invite them to please share ideas that they have. There's certainly lots of wonderful workplace programs that people do and that have done all over. I think integrating them into the actual point of care. You know, we've done some where we actually tried one in the hospital where people show up for 30 minutes and they actually did. And we actually studied to show that we could reduce even for like a 30-minute quick shift for a nurse to come down. We've tried a lot of things with our students, had wonderful success. And then of course the dean's office cut the funding for it. But you're right, there are a lot of really great well-being workplace programs. I would love it if anyone wants to hop on video and tell us about something they're thinking about. But you are right, there's a lot of things out there that I did not talk about today.
Let's wait a moment to see if anyone would like to address this or another question live.
And feel free to come on video. I'd love to see people.
Yeah.
And I realize there's an incredible amount of expertise on this call already.
While folks, because of our timing here, I think a lot of folks are in transit now to clinic, but let me go through the chat. Oh, there we go. Kavita, welcome.
I'm just going to ask a quick question, which is what a lot of people will ask. Hi there. Fantastic talk.
Thank you.
Students or fellows or other MDs, you know, they'll say, hey, how much will actually make a difference? I only have 1 minute, or I can only do it once a week. Or how do you help guide what might be a minimal dosage of meditation?
It's a great question. And again, I bet there's better answers on the call, but here's how I answer it. If someone says to you, how much should I exercise? I know there's guidelines from the American College or whatever, but the bottom line is the more you kind of do it, the better. Like the more you take the stairs, the better. The more you get up and walk once an hour, the better. And so I would invite people to say that a lot of the studies are starting to look at shorter and shorter timeframes, but it's not going to be a magic bullet where you can meditate 10 minutes and all of a sudden see all the benefits. So what I say to people, and again, I invite others on the call to please weigh in, is the more you integrate this into your life, the better. So the more you practice in your downtime, so I do have a 10-minute practice in the morning, the more then you can access it during the day when you really need it. Right before you walk out the door, you can take just a moment and your body kind of knows like, all right, I'm going back into a familiar zone. Let me go here before I go through the door. So the more you practice when you can, the better you can access it when you really need to. And then again, I would say to people that consistency is more than length. So if you're all of a sudden a 60-minute meditator, that doesn't matter to me. Even just 60 seconds a day, getting it into your habit and your routine, and then being able to build in and think about it like exercise. The more you can just figure out a routine and tuck it into your life, going to be the better for you. I don't know if that's a terrible answer. If anyone has a better one, I'd love to hear it, but that's what I say. Better to do it than not, right? Like it's kind of like exercise. Take the stairs. If you can't get to the gym, that's fine. Take the stairs. You're doing a great job, is what I'd say.
One of our practitioners, Dr. Kwan, says she likes to call minutes of mindfulness a resilience vitamin.
Beautiful. I love that. A resilience vitamin. And just a minute, see? Just a minute, 60 seconds. Perfect.
I love what you're saying, Sean, and we've been trying different ways of having upstream interventions in the sense of including components of mindfulness in medical education. instead of having to then undo so many habits and unhealthful practices, but really trying to integrate it. And I'm curious if you've seen this as well, but over the years, much more receptivity and motivation among the newer cohorts of medical students. So do you feel that the word has gotten out in a way that allows us to accelerate our changes?
I do, absolutely. And we're doing a project here in Cincinnati, which I'm so excited about, where we're pairing meditation with dissection. We had so many students telling us how distressing dissection was. And so we actually put out a pilot by some of our mind body faculty to where people could come if they wanted to and just come for a 10-minute. And the amount of students that showed up for just this 10-minute pre-dissection meditation. And then again, so absolutely. And I think it's up to us to now figure out how do we, like you said, how do we weave it in? So it's not a standalone thing, but it's part of what they do and part of what we do regularly.
I think I love that idea. I hadn't heard about that yet. We have had yoga and mindfulness taught during anatomy as a way of being aware of the body. And then also, Dr. Connor's here. I'm not sure she'll be able to join, but our clinical reasoning courses, teaching mindfulness, exactly what you were describing, that space between the initial thought and the response as a way of eliminating or being aware of implicit bias in diagnosis. So there's so many applications that are obviously relevant to healthcare, let alone people's full lives.
Agree.
Now, we are committed to ending in time to allow people to get to their next meetings. And I know there are many more questions. I hope you'll be okay with folks getting in touch with you.
Oh, absolutely.
Directly.
I can't put it in the chat, but it's just sean.cotton@uc.edu. Just email me. I'm happy to answer any questions, have any conversations that would be of help. And again, look forward to learning from all of you. I realize the expertise on the call this morning.
Thank you so much. This has been absolutely terrific. Lots of engagement. I'm sorry we weren't able to include more of it. Well, we'll have to extend to 2 hours next time we have to give grand rounds. Thank you so much for joining us. This has been terrific.
Of course. Thank you for the invitation. Thank you all. Have a wonderful day.